The agenda for today's training will include and cover the following topics: survivor's guilt, acute suffering interventions, local knowledge and crisis management solutions, recruiting and training community members, mental and physical health care, distress, well-being resources, trust and confidentiality, vicarious trauma, and then we will conclude today's workshop with a question and answer portion. As part of the training, there will be definitions and symptoms, videos, reflective activities, and an opportunity at the end to provide comments. Survivor's guilt can stem from survivors feeling guilty that they have survived when others have died. Also, others believe they could have done more to save the lives of others. And then there are those survivors who feel guilty that another person may have died while saving their life. Symptoms can be both psychological and physical, and often mimic those of PTSD. A mental health professional who is trained in coping skills therapy can possibly help a survivor address feelings of guilt through psychotherapy. Symptoms of survivor's guilt can include a lack of motivation, mood swings, obsessive thoughts, suicidal thoughts, headaches, or even appetite changes. Interventions to acknowledge acute suffering. Psychological interventions and the therapies listed below are designed to prevent the onset of PTSD and the development of trauma-related stress symptoms soon after exposure to a traumatic event. Psychological debriefing interventions aim to educate victims about normal reactions to trauma and encourage them to share their experiences and emotional responses to the event. Debriefing is typically offered in a single session over a few hours or days after the event and offered to people exposed to the event. There may also be a need for psychopharmacological interventions or medications, and further study is needed on emerging interventions like meditation and guided imagery. When addressing acute trauma, factors that should be considered include other health outcomes such as symptom reduction, prevention of comorbidity of medical and psychiatric conditions, improved quality of life, or ability to return to daily activities or work. Symptoms can also include excessive worrying, difficulty concentrating, racing thoughts, fatigue, restlessness, crying, loss of activity or interest, changes in weight or appetite, or thoughts of self-harm or suicide. This is not a comprehensive list, and it is possible for someone's response to acute trauma to look different based on their environment, background, and other contextual factors. Local knowledge and crisis management solutions. Public health and emergency management agencies play an essential role in addressing the needs of vulnerable populations in preparation for and in response to emergencies, disasters, and crises. Identifying and leveraging community assets is one way to address such needs. Community leaders' engagement in the preparedness efforts can be important in identifying community assets that can be used to address the needs, especially of the most vulnerable segments of a community. Local knowledge and local community leaders and experts can guide research and support the implementation of projects. All communities and their needs are different, and the responses to crisis should be culturally competent and informed based on local dynamics. Now we will watch a video that is an example of how local knowledge is effectively leveraged during a crisis management situation.
Climate change and disasters affect everyone. However, the harsh truth is that they impact some people more than others, especially people with disabilities, women, children, the elderly, the poor, religious, ethnic, or caste minorities, and other marginalized groups. People at the intersection of these factors are even more vulnerable. For instance, the 2015 Nepal earthquake disproportionately killed more women than men. It pushed more than 700,000 poor villagers below the poverty line. Most of them were smallholder farmers. Some were landless, marginalized castes, also known as Dalits, and many were female-headed households because farming is a typical job that female villagers can access. Those with compounding vulnerabilities faced severe challenges during and after the earthquake. South Asia is one of the most vulnerable regions to climate and disaster risks. The World Bank and the GFDRR work with governments in South Asia to ensure that resilience is truly for all. There are many practical actions we can all take to build inclusive resilience in South Asia. For example, early warning systems that work for those with hearing, visual, or other types of impairments. Evacuation shelters that are accessible to those with limited mobility, non-discriminatory to those from groups such as marginalized castes, religious minorities, and LGBTI communities, and safe for women and people requiring care. Embankments, roads, and bridges that ensure accessibility and safety for people with different needs. Resilient infrastructure that can be built with a workforce from diverse backgrounds. Disaster risk management policies that ensure fair and equal access to recovery assistance, including joint ownership of property. Geo-referenced social registries and safety nets that quickly identify people most in need of evacuation and recovery assistance. Community disaster risk management plans that are participatory and reflect the needs of people with different backgrounds and capabilities. Social inclusion doesn't have to be expensive or difficult. An inclusive approach will promote a more resilient and prosperous society. Inclusion matters for resilience in South Asia. To learn more, please visit www.worldbank.org, South Asian Inclusive Resilience. The Global Facility for Disaster Reduction and Recovery, GFDRR, the World Bank.
I will first now play a video with an example of how a member of a community provides essential psychosocial support services. Please watch the video and then we will discuss community members and their role as they are trained and recruited to provide services.
أنا محاسن خطاب، عمري 31 سنة. بشتغل كعاملة دعم نفسي في مخيم أطمن النازحين، وعايشة ببيتي مع أطفالي وزوجي اللي تعرض لإصابة أدت هاي الإصابة لإعاقة دائمة. أنا من بلدة كفر زيتان تابعة لعرف حماة الشمالي، نزحنا لهون من عام 2012. بصحى من النوم كل يوم وعندي أمل إني أعمل تغيير بحياة أي شخص محتاج. عائلتي وأسرتي هم كل شيء بحياتي، بس إنه شغلي بحسسني بالرضا والنجاح والسعادة. لما بلتقي مع الناس بسمع قصصهم وحكاياهم، بتعايش مع ألمهم، بحاول إني أساعدهم وخليهم يتخلصوا من هاي الضغوطات والمشاكل اللي عم يمروا فيها. كتير من الأطفال فقدوا أهاليهم وتحولت أحلامهم لكوابيس، وانحرموا أهم حق من حقوقهم هو التعليم بالمدارس. كان الحرب كتير تأثير مدمر على الناس، سواء كان رجال أو نساء. نتيجة تأثرنا فيها صار كلنا لازم ندعم نفسي، وواجب كل شخص أن يقدم الدعم حتى لو كانت مواردنا محدودة. في نهاية اليوم نحن عم نعيش لحتى نرسم ابتسامة، نمسح دمع، نخفف ألم، ونزرع أمل للناس.
Community health workers and mental health workers are trusted individuals who assist in improving health through the promotion of psychosocial support, education, crisis management, counseling, and other client care to all members of their community. Although they occupy a number of roles and responsibilities, their work is linked to health outcomes and improvement, and they provide valuable support in disaster and crisis response. When a community is faced with a disaster, they may need to be able to step up and offer emergency psychological and emotional aid, especially in the areas of providing emotional and social support and assessing resource availability and medical needs. Based on their training, community health workers may be able to provide counseling to those in need if they are unable to meet their needs, and provide referrals for appropriate professionals for those specialized services. Community aid workers and mental health providers may also be able to assess the needs of those in their community and signing them up for post-disaster recovery aid. Being a community health worker means often living in the communities they serve, so they are aware of the everyday needs of their fellow community members and neighbors, and therefore should be able to conduct an accurate assessment of the availability of resources and what resources have been lost following the disaster. Mental and physical health care. A conceptual framework for assisting disaster victims involves understanding individual and environmental risks that influence physical and mental health care post-disaster. Some victims may be at risk for mental health problems such as PTSD, substance abuse, and depression. Those risk factors after the disaster can also be affected by previous mental health problems and the level of exposure to disaster-related stressors, including a fear of death or injury, exposure to injury or death, family separation, or prolonged displacement. An action plan should involve preparation for what responses will be necessary for both physical and mental health care. Mental health outcomes for survivors can include depression, PTSD, anxiety, and suicide, especially for vulnerable populations. A disaster or crisis could also exacerbate a physical health condition such as high blood pressure or diabetes, or worsen overall physical health due to lack of preventative care or access to hospitals or clinics. I now have provided some reflection questions on this slide. Please take a moment to review. Emotional distress can be a state of emotional suffering. Distress can encompass a wide range of symptoms, and people can experience it at any time. Mental health disorders can cause symptoms of emotional distress that persist over long periods of time or that can occur in cycles, and the characteristics of this distress can depend on the presence of other underlying mental health conditions or disorders. The symptoms of emotional distress are sometimes severe and could develop into a mental health disorder. Resources to improve well-being. On this side, you will see links provided to global resources to improve well-being. Please take time to review the links and the options provided for both clients and providers of services and treatment. Respecting clients' confidentiality and privacy are considered a part of their rights. Confidentiality is a key component for trust building in the client-provider relationship. A provider should be aware of local laws, policies, and ethical standards regarding confidentiality, both in their home country and their host country of research and practice. Cultural awareness on what trust and confidentiality means in a different cultural context are also important. An ethics board and professional regulating body can offer guidelines and standards for professionals conducting research or clinical services. Vicarious trauma, also known as compassion fatigue, generally describes a condition that affects the mental health of service providers. Vicarious trauma is the emotional exposure that counselors and mental health providers experience while working with clients after hearing their trauma stories, and providers become witnesses to their fear, pain, and terror. Vicarious trauma is also a state of preoccupation and tension from the stories and trauma experiences described by clients. The tension might be experienced by counselors and providers in many ways. It can also impact the provider's personal life, including relationships with friends and family, as well as emotional and physical health. Counselors should be aware of the signs and symptoms of vicarious trauma and the potential emotional effects of working with trauma survivors. Signs and symptoms might include feeling startled easily, loss of sleep, worry about not doing enough for clients, dreaming about their clients, feeling trapped in their work, diminished satisfaction and personal accomplishment, dealing with intrusive thoughts, especially around severe trauma histories, and feeling hopelessness associated with their clients and their work. It can be important for providers to seek out their own psychosocial supports, therapy, or counseling as they conduct this work and deal with the trauma histories of their own clients. On this slide, you will find a reflection activity on vicarious trauma. Use these questions as a guide to reflect on your own work as a mental health provider or counselor. This now concludes the workshop and training. I would like to thank you for following along and participating in today's training. If you have any questions or comments, now will be the time to share and ask. Once again, thank you for your participation and attention during today's workshop. This last slide includes the references referenced and cited for this workshop presentation. Thank you. Please feel free to review.